Today, I really want to talk about burnout. What is burnout? Well, we kind of know what it is. It is known to make you tired, but it actually is something that hijacks your brain. So today, I want to talk about you, or maybe I want to talk about us, because while we spend our days helping others heal, we almost never stop to ask what is happening in our own systems. I'm Dr. Arwen Podesta. I help addiction professionals improve patient engagement and recovery outcomes using integrative, evidence-based strategies. Today, we're going to flip the lens. We're going to talk about burnout for us, not just how it feels, but what it does to our brain and body, and how to reverse it using similar tools that you already give your patients, because your outcomes improve when you're well too. So let's talk about it. What does burnout do to you, and what can you do about it? As addiction professionals, as mental health professionals, we are usually ready to show up. We're used to being regulated, continuously being composed. We're always here to hold space for others, patients, clients, colleagues, friends, no matter what is unfolding in front of us. But something we don't say out loud very often is, honestly, holding space gets heavy. It's not just the caseloads or the paperwork or the crisis calls at midnight. It's also the emotional labor of just consistently witnessing and talking about and thinking about suffering day in and day out. It's using our skill sets despite frustrations. It's digging deep using all of the tools in the toolbox, which are a lot. And it's the invisible weight of showing up strong for patients and clients, while sometimes privately, we might even be falling apart on the inside. And over time, honestly, we all know this, that weight builds. It can chip away at our focus, our patience, our empathy. Maybe noticing things like clinical decisions take longer, charting feels more laborious, multitasking is less accessible. And that once automatic sense of connection with patients might start to fade. But instead of stepping back and asking, what do I need? We go full force and we just push through and we double down because it's what we've always done. Ironically, the better we are at helping others regulate, the easier it becomes to ignore our own dysregulation, until one day we realize we're burned out, not just tired, but we're changed in a way that affects our patients, ourselves, our loved ones, changed in ways that aren't just going to fix themselves and right themselves. If you've ever felt that, had a moment of wondering, is this still sustainable? You're absolutely not alone. And by the way, you are not failing. This is what our system creates. But once we see what's happening, we can reverse it. We just have to start applying the same evidence-based recovery tools to ourselves the same exact way we teach them to our patients. And look, let me be honest with you. I've experienced burnout more than once, and not the kind you push through with just a weekend off and then you're back and regulated. I mean, actually true dysregulation, physically, mentally, professionally. 13 or 14 years ago, I was stretched across a ton of different roles. I was medical director at a very large facility with multiple locations. I was driving a ton. I was also teaching, doing consults, opening my private practice, and more, seeing patients, caring for patients all over the place with different hats on. I was learning. I was in leadership roles. I was doing, but you know what? I wasn't sleeping through the night. This is where many professionals talk about, it's kind of a badge at some point in medicine and other fields as well, like waking up at 3:30 in the morning, who got up earlier, trying to solve problems at work. But after a couple of months of that, I was physically and mentally inflamed. My cortisol levels were high. I was still doing yoga. I was still taking all my supplements. I was working out in other ways. I was doing a lot of meditation. It should have been enough. But with that level of load, honestly, it was not enough. So I had to make some decisions, some hard ones, really. I had to step back from one of my roles, and it took over a year to transition out and let that fully go. But I luckily had a very supportive partner, a therapist, my work team, and with all of them together, I started being able to set work boundaries, real boundaries, and hold to them. And that really changed everything. But you know what? That wasn't the end of it, because then came the pandemic. And like so many of us in psychiatry, addiction treatment, in any sort of mental health space, I shifted to telehealth. So I was isolated from my patients. I was cut off from the workforce of the energy of my team that surrounds me. And we know how much that face-to-face fuels our positive energy and resets us. My habits were really good for the most part, but I was off again. I was irritable. I was inflamed again. My sleep was disrupted again. I was disconnected. And so I took myself on a vacation to reset. And during that vacation, I went snorkeling just to try and relax. But I realized while snorkeling, I couldn't breathe. I was underwater and gasping and panicking. And after I thought about it, I made it back, obviously. And after I kind of sat on that idea, I thought, what was going on? What is my body telling me? And in fact, it was saying you've lost connection to your breath. And so that day, I committed to something different, not just breathing at the start and end of my yoga workouts, not just doing the same routines, meditation and other resetting things that I've done for decades, but I added in particular types of healing, intentional daily breath work, and I still do them today. And I still work on keeping work boundaries very clear, plus all the other things. And you know what? As we have more cortisol in our system, and as we have more stress, and as we do more, and as we age, we might need to add more and more. Keep on looking under the hood and finding out what's going on. But what I know is that when I regulate me, I can show up more fully for everyone else. I, over the years, have met so many brilliant, dedicated clinicians, professionals who've either been through burnout or were quietly teetering on the edge saying, I'm fine. And yet, of course, we knew something was going to happen. They almost always said the same thing. I didn't even realize how bad it had gotten. I just thought I was tired, or I just thought I was drinking too much coffee or whatever. But it wasn't just tired. It was really the physical system on overload. It was neurobiological wear and tear from years of doing and holding space for others without enough space held for themselves. And those professionals knew the tools. They taught the tools, but they rarely gave themselves permission to use the tools, which is exactly why this conversation matters so much. Because once we stop pretending we're immune to burnout, or once we actually acknowledge that we are susceptible to burnout, we can start recovering from it for real. I want to pause here for a second. If any part of that story felt familiar to you, if you've ever hit a wall or felt yourself running on fumes while still trying to help others, just leave a comment below, even just a yes, or that's me, been there. It would be helpful. It helps all of us see that it's possible, especially in this field, and it helps us know that we're not alone. So let's talk about what's actually happening in our brains, because this is about physiological dysregulation, the same kind we see in our patients, especially those with chronic stress, those with trauma, those with substance use histories. Here's what I mean. When we're constantly under pressure, emotional, cognitive, environmental, malnutrition, other stress responses, everything becomes chronically activated. And that chronic activation actually reshapes our brain. Under sustained stress, the prefrontal cortex, which governs executive functioning, empathy, impulse control, starts to go offline. And meanwhile, the amygdala, the threat detection center, it becomes on overdrive. It becomes hyperactive, and we become more reactive. Our personalities, our emotions are more volatile, and we're more easily overwhelmed and irritable. And it's the exact pattern we treat in our patients, but now it's in us. And because we're still functioning, still showing up to sessions, still answering emails, still charting, still doing, still driving long distances to multiple sites, still seeing patients and clients, despite all of this, we actually go into a little bit of an autopilot and not realizing how impaired we have become. We call it just being busy or having a rough season. But if your nervous system is stuck in high gear, if your mood, your focus, or your memory are off, if your body feels constantly tense, you're finding it hard to feel present with your patients, that is not a personal failing. That's your brain adapting to the chronic stress, to the chronic overload. In the same exact way, the brain can wire into dysregulation. It can also wire out. That's the beauty and the promise of neuroplasticity, but it's not automatic. Healing requires intentional recovery practices, the same ones we prescribe for others, the same ones we recommend and teach. And they only work when we allow ourselves to use them consistently without guilt. When we stop thinking of wellness as a luxury and start seeing it as a professional responsibility, because your brain isn't separated from your clinical work. Your brain is your clinical work. The more regulated you are, the better you think, the better you connect, and the more you are able to be empathic and show care. And it's not just good for you, it's good for your patients, and it's really great for that teamwork of outcomes. So now that we understand what burnout actually does to the brain, what do we do about it? Because I know what you might be thinking. Oh, sure, I'd love to do that. I'd love to reset my nervous system, but I've got back-to-back sessions. I've got a wait list 3 months long. I've got 100 million open charts, and I totally get it. And that's exactly why these tools need to be fast and functional and flexible. Something you can do between patients, whether it's at the nurse's station or in your car before walking into work or after you leave work or all of the above. So let me show you how I approach it in my own life and how I teach it to professionals I train. Microregulation. We talk about self-regulation all the time with patients, helping them build awareness, reduce reactivity, return to baseline. But are we always doing that for ourselves? And if so, is it enough? So between sessions, I like to take a couple of minutes to reset my nervous system. Before I was in medicine, when I was a massage therapist, I learned to do that too. And it was in between clients, in between patients, same application. So it might look like a slow, coherent breath. Sometimes it's putting my hand on my chest and taking a real felt interoceptive breath. Sometimes it's jumping and shaking your hands, energizing the whole body. Sometimes it's stepping outside and letting the sunlight hit my eyes for 60 seconds. A brisk walk, jumping jacks, squats, any bite-sized thing that you can do to regulate your nervous system in between patients to get out of your thinking brain and get out of the cortisol brain. These are little neurobiological resets, and they keep me from carrying all that emotional residue from one patient to the next. Then there's what I call nourish, don't numb. When we're maxed out, obviously it's easy to lean on the quick fixes, extra caffeine, a little junk food, a little sweet snack, slumping in your chair and mindlessly scrolling, ignoring things, tuning out maybe. But over time, those habits become habituated and they actually chip away at your internal resources. So I started asking myself one simple question. Is this habit restoring me or just distracting me from how depleted I feel? Instead of numbing, I choose something that nourishes me. Everything I said before, a short walk, a warm meal, a few minutes of connection, a meaningful connection with someone I trust. The same behavioral tools and exercises we teach our patients, we need to model them for ourselves. We need to lead by example. And finally, I want to offer a functional medicine lens on burnout because honestly, it's not just emotional, it's totally metabolic as well, hormonal, neurochemical. And if your system is depleted, inflamed, dysregulated, no amount of mindset work will fully pull you out. So I truly recommend that clinicians run their own labs or get your primary care provider to run your regular labs, just like we do for our patients. Check your cortisol curve, look at your own vitamin B12, vitamin D, thyroid, inflammatory markers, MTHFR gene, and more. Make sure you are well supported in these areas. You have to support your brain and body with targeted nutrition, also maybe add adaptogens, have your sleep protocols together for you. Whatever you'd recommend for a patient, give yourself permission to do the same because your wellness isn't a luxury. It starts with treating yourself like someone worth caring for. Burnout does not mean you're broken. It means your system has been doing what it was designed to do: adapt under pressure, survive in stress. But survival mode is not enough anymore, not for you, not for your patients. And you became a clinician because you care. You stay a clinician by learning how to care for yourself too. When you're well, when you're truly well, your clinical intuition sharpens, your presence deepens. your outcomes improve, your empathy expands. If you're at a point where you feel steady again and you're ready to turn that clarity back to your patients, awesome. In the next video, I'm going to show you how to use the same integrative root cause lens to radically improve care for the people that you are serving. Until then, take one breath for yourself, step outside if you can, have something nourishing, hydrate, rest your eyes. You don't need to earn your healing. You just need to begin. I'm Dr. Arwen Podesta. Take care of yourself because we all need you well.